Good morning, everyone. I'm Kristen Wheeler. I'm the program director at the Institute at the Golden Gate, a program of the Golden Gate National Parks Conservancy in partnership with the National Park Service. And if you're still with me, then congratulations, because that was a mouthful. I'd like to kick things off by asking everybody who works in a park agency, volunteers in a park agency, or who has ever spent time in a park to stand up. Anybody still sitting is probably in the wrong room. No, I'm just kidding. Well, I would like to thank you all for being part of our healthcare delivery system. Every single person who just stood up should consider them part of the solution to our healthcare crisis. I'm sure Dr. Baxter would be glad to know he's got lots of colleagues in the room helping with the health crisis we're all facing. So the mission at the Institute is to look at the solution that parks and public lands can play in solving some of the biggest environmental and societal issues we're facing today. And I think we could probably all agree that the health crisis we're facing here in the San Francisco Bay Area, in the state of California, and across the country is one of those biggest areas. But it's also an opportunity. It's an opportunity for parks and public lands to really be seen as preventative and treatment for these health issues that we're all dealing with. So whether you're dealing with physical ailments, you need a place for stress reduction, you're trying to boost your vitamin D, or you just need time away from your job, parks are a wonderful place to reap all of those benefits and ultimately thrive in, to take a wonderful word from our friends at Kaiser Permanente. So I am honored today to be introducing our panelists. Speaking to Director Jarvis a few minutes before this, I think we shared that we finally get to have a very positive thing to open with, which is always exciting. We are making headway when it comes to connecting people to parks for their health. And we have a couple of panelists today to tell you how they've been doing it for the last few years. So to start things off, we'll be joined by Dr. Ray Baxter of Kaiser Permanente. Ray's the Senior Vice President of Community Benefit Research and Health Policy, headquartered right here in Oakland, California, so not a long jaunt away. And then after that, we'll hear from some of my favorite park rangers in the whole system, Maria Jose Alcantara and Fatima Colindres. And if you ever get the chance to go out into a park with these two, you'll very quickly realize that it's not a job for them. They make this very personal. The Park Health Connection is personal for both of them. They've been spearheading the programs on the ground here in the Bay Area, which is taking off across the country. After we hear from these wonderful speakers, we'll be joined by Director John Jarvis of the National Park Service to hear his remarks and join us for a discussion. So without further ado, I would like to pass it off to Dr. Ray Baxter.
Good morning. Thank you, Kristen. Thank you to the George Wright Society and to all of you who are here today, Director Jarvis, for the tremendous work that he leads and the work that all of you do. It's a real pleasure to be here on behalf of Kaiser Permanente and to talk today about a perspective, which is that nature is medicine. For those of you who may not know Kaiser Permanente, we are an organization that began 70 years ago in the shipyards in Richmond, not far from here. Henry Kaiser, an industrialist building ships, and Dr. Sidney Garfield, a physician who pioneered a way to take care of the workforce of Kaiser Industries by accepting a small amount out of the salary of every worker in exchange for prepaid care, all health care that those workers would need. The picture you're seeing here comes from that time 70 years ago. That is a staff physician of Kaiser Industries in the shipyards talking to workers about the common cold and about prevention of workplace industries. So Kaiser Permanente is an organization that from its beginning has been about prevention, has been about health, not just about health care and the treatment of acute illness. Its mission is to provide high-quality, affordable health care to improve the health of our members, also to improve the health of the communities we serve. And from the beginning, as I said, it's an organization that recognized that health is not something that's created in a doctor's office or in a hospital, but in the workplace, in schools, in the communities and neighborhoods and society that we live in. So our strategic vision, which outlines that, is one that is called Total Health. Total health to us means to be a leader to helping people to achieve a state of complete physical, mental, and social well-being for all people through all of our activities, including promoting clinical, educational, environmental, and social actions that improve the health of all people. So why is Kaiser Permanente interested in nature, and how does that fit into this mission and vision of the organization? We are well aware, as I said, that there are many factors that shape people's health. And in fact, we represent about 10% of that contribution. Most of what shapes people's health is really family history and genetics, more than anything, behaviors, personal behaviors, and those behaviors are typically shaped by social and environmental factors that shape the opportunities people have, in this case, to be healthy, to take care of themselves, or living in an environment that undercuts and undermines health. So we have to be concerned not only with medical care, not only with genetics and family history, not only with personal behaviors, but with the environments in which our members live. And in order to do that, we have to be prepared to engage in every aspect of the environment that shapes people's health, not just providing excellent health care, physical health, behavioral health, social health, not just engaging actively in prevention, but engaging in every aspect of the society that shapes the health of our members. So still, what does this have to do with nature, and what does this have to do with parks? This is a heat map. Many of you have probably seen a heat map before. What this does in this particular thing is to show geographically the concentration of childhood obesity in the Bay Area, right where we're meeting today. So the deeper the orange into red is, the more intense the concentration of childhood obesity is. In this case, the green spaces are exactly that. They're green spaces. So you see that in general, the tendency is that further people are from green spaces, the more likelihood there is to be a concentration of childhood obesity. Now, you could say, well, we understand why those concentrations of childhood obesity look that way. Those are in poorer neighborhoods. Those are people who are probably uninsured, don't have good access to care, or they don't have access to good health care. However, this is not a map of everyone in the Bay Area. This is a map of Kaiser Permanente members. So they all have coverage of one kind or another. They all have access to the same doctors, the same clinical care, the same prevention, and so forth. And yet the degree of disparity in the prevalence of obesity varies extraordinarily by geography. The places where people live shape their health in very powerful ways. And I could show you this same map about depression, cardiovascular disease, diabetes, a whole range of conditions, and it would look similar. Well, so is this just a coincidence? Common sense tells you no. But what are some of the things that we are up against? So this is well, you're obviously looking at the picture, but if you pay a little attention to the graphic, this is the relationship between the amount of time you spend in a car and the probability of obesity. Americans today in urban areas do 7% of their trips by biking or walking. People in the Netherlands, for example, do almost half of their urban trips by walking or biking, an extraordinary difference. So the amount of time you spend in a car rather than on foot or pedaling has a great deal to do with this. So if I ask those of you who are from the Bay Area, you know, what's a healthier place to live if you're working, let's say in San Francisco, is it healthier to live in Oakland or is it healthier to live in Walnut Creek? And probably a lot of you would say Walnut Creek. I mean, Oakland's my town. Oakland, no, it can't be as healthy. But think about the person who's commuting to work from Walnut Creek, particularly by car. And that person has a higher likelihood of obesity, higher likelihood of cardiovascular disease, and a number of other conditions correlated directly with the amount of time that they spend in a car, because they are spending a lot of their time doing absolutely nothing but sitting, which we now know people are starting to say that sitting rivals cigarette smoking, sedentary life does. So let me just warn you that if you sit here for 4 hours this morning without moving, that's close to a half a pack of cigarettes in terms of what it does to your life. So I just want to put this in perspective for you. We are also not spending time outdoors, and even worse, our children are not spending time outdoors. So much of Kaiser Permanente's entry into concern about parks and nature and the relation to health obviously has to do with activity. The more access you have to outdoor spaces, safe outdoor spaces, pleasant outdoor spaces that are designed for walking, for movement, and so forth, the more likely you are to be active. So our initial focus on this, as I'll show you in a moment, was very much around engaging in creating more opportunities for people to be active. But as we came to learn more from people like you and many others around the country looking at the health benefits of nature, we came to understand that, in fact, it represents many greater benefits, not only physical benefits because of more likelihood of acting, but developmental benefits for children and young people, mental health benefits, educational benefits, community benefits, and economic benefits for communities, all of which are related to health. So if I go back to that original slide, the conditions for health are not simply good health care and health coverage. They are living in safe and secure places, in communities that are vibrant and have social cohesion, in places that are economically prosperous, that have good educational opportunities, and where children in particular are given all the opportunities and encouragement to develop. So health is dependent on all of these factors, and there is now a scientific base of evidence. A scientific base of evidence, not just common sense, not just belief from those of us who love the outdoors, that access to nature and outdoor activity has benefits in each of these areas. And I'm not going to go through all of these in detail. There's a volume that I'll recommend to you, and we can tell you later how to get a hold of it, that was just produced called Improving Human Health by Increasing Access to Natural Areas. This was done by the 2014 Berkeley workshop, and a very diverse group of people cutting across health, conservation, environmental advocacy, education, a whole range of sources. Kristen was part of this. Many of our colleagues were, has compiled a lot of the evidence that now exists in peer-reviewed scientific literature of all of these benefits from health. So physical activity, body weight, stronger muscles and bones, better eyesight, restoration from disability or injury or insult to the body. Sure, all of these physical benefits are becoming well documented, but so are others. The developmental benefits to help people develop socially, cognitively, emotionally, not just physically. The mental health benefits in lower levels of stress, increased energy, reduced symptoms, and so forth. Educational benefits around creative learning, resilience, things that we are learning are so important for the development of strong, capable young people. Benefits to entire communities in terms of increasing social cohesion, more frequent use of outdoor space, increases in property values. And more recently, with a study published early this year or late last year, significant economic benefits to communities that have significant access to nature and outdoor space and parks. Everything from property values to health savings, to air quality gains. So for all of these reasons, Kaiser Permanente is committed to access to nature as a strong determinant of health. We are interested particularly in steps that will achieve equity in people's access to nature and to being outdoors, efforts that target underserved communities. We are trying to find creative activities in which we can engage with other partners that have multiple benefits, that benefit the environment, that benefit people's health, that benefit the development of communities and the strength of neighborhoods. We're still heavily focused around healthy eating and active living, but we're now broadening that thinking out to understand all of the many benefits of access to nature. So we have a whole series of programs that we engage in over 50 communities around the country to really increase healthy eating and active living. And a core part of that, most of it captured in the neighborhood section of this slide, has to do with increasing access to parks, building trails, other active public spaces, helping communities organize to achieve changes in their general plan that will increase open spaces and access to them, work on healthy food and bringing healthy foods into communities, the development of community gardens, and many other activities like that. We also are doing things that build all of this into our clinical activities, so it isn't restricted to investments in the communities and support for good causes. Walking as a vital sign, activity as a vital sign has become something that we are doing across the organization in the process of rolling out now. Let me just ask, are there any Kaiser Permanente members in the audience today? So if it hasn't happened already, it may happen soon to you when you encounter the system. It doesn't matter if you're in the emergency room for a sprained ankle or you're there for your mammogram or something else, that you will be asked, are you active? Just as you're asked, do you smoke or did you ever smoke? You'll be asked, are you active? What do you do? How many days a week? How many minutes a day? And that gets charted as a vital sign, just like smoking, just like blood pressure and other things. We think routine activity is that important for people that we're building it in. But we realize it can't stop with a question and a prompt. It has to be followed with things that help people find ways to be more active. Walking, rolling, physical activity built into the normal living day are critical to that. But many people say, well, I don't live in a safe area, or I don't live in it, and I don't just mean crime, I mean trucks, I mean the lack of sidewalks, all of the things in communities that discourage people from being active and to moving toward open spaces. All of those are things that we have to work on. A few years ago, we founded a national collaboration that now has over 250 national organizations in it called Everybody Walk, which is designed both to build demand, that is to get people walking, and to make communities more active. And as I said, there are now 250 or more organizations nationally dedicated to changing our environments, changing our culture, changing our norms, so that being outdoors and being active becomes a default activity, not something special and unusual. We've worked, for example, on major contributions to the Beltline Trail in Atlanta and the Metropolitan Branch Trail in Washington. And our particular focus hasn't just been another banner and another sponsor for another mile in the trail, but helping create the access routes that get to those trails, that make sure that people in underserved communities have access to those outdoor activities. Helping everybody get active in nature. Our work in LA, for example, in funding fitness zones right in the cities in Southern California is another example of that. We have a long partnership with the Trust for Public Land, both for helping to acquire spaces and also to help them be used in ways that will benefit people. In Portland, for example, and in other communities, we've worked on resource guides for people about how to get places without using your car. And we partnered with many organizations, including the Children in Nature Initiative, which many of you are probably familiar with. So altogether, over the past 7 years, we've contributed nearly $11 million toward creating and supporting access to parks, nature, and open spaces for all the people in the communities we serve. We think this will become an increasingly important of our activities. We've had a wonderful partnership here in the Bay Area with the East Bay Regional Park System, one of the most wonderful urban area park systems in America, for getting people to it, encouraging use of it, and so forth. And we see that as increasingly important. Access to nature is fundamentally essential for human health, in our view. To add to all of the accumulating evidence we're acting on is some fascinating recent information that some of you may be starting to hear about, which is the power of awe, A-W-E. It's becoming evident that the experience of awe actually has psychoactive effects on people, which increase brain strength, resilience, and other things. Where else but in nature, whether it's a tiny spider on a little web early in the morning, or a peak experience like the one described here, can we get that sense of awe? So to all of those other benefits I was adding earlier, we need to think about the potential of nature to create awe in people, to take us away from our daily experience and add to all those other benefits of health. So Kaiser Permanente is committed to health. Because we are committed to health, we are now committing ourselves to nature. Thank you very much.
Thank you so much, Dr. Baxter. And that actually, if you can't tell, that is Ray. So he himself gets outside in nature and gets healthy. I would like to turn it over to Maria Jose and Fatima now.
Good morning, everyone. My name is Fatima Colindres. I'm stationed at the Presidio, San Francisco. So because I'm stationed there, I need everybody to stand up. Oh, yeah. Stand up. You know, the Presidio, San Francisco was a military base for a very long time, until 1994. So get comfy, because right now, you're all going to be soldiers. Oh, yes. So attend hut, and we're going to march in place. Left, 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 right, left, 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 right, left. We're going to double time it. That means you're going to go a little faster. Left, 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 right, left, 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 right, left, and a little bit faster. Faster. Oh, yeah. Triple time it. Get that heart pumping. Oh, that feels good. Okay. At ease, everyone. Sit down. All right. You know, I couldn't have you getting sick with that secondhand smoke type of feeling, right? We needed to get moving. I like to move. So I want to start off by telling you a little story. That's what I love to do in the park. I like to tell stories. And where Healthy Parks, Healthy People was born in my heart. Now, let me ask you a question. Have you ever felt like you wanted to get outdoors? You wanted to get healthier, get more active. But for some reason or other, your body just was not there with you on that one. I went through that myself. Yes, I did. I was 282 pounds. I could barely move. I was having a hard time. But you know, I live in the Presidio, so I was surrounded by nature, and I wanted to get outdoors a little more often than just when I'm at work, right? But I just couldn't. Now, the reason why I was having a hard time was because every single joint in my body was hurting. I had no idea why. I went to the doctor. They had no idea why. They did many studies. Finally, it turned out that I had rheumatoid arthritis. I was in pain. I was embarrassed that I couldn't keep up with my fellow coworkers when we were on hikes or when we were leading programs. It was bad. I was with canes, I was with crutches. I even was hoping for a wheelchair at one point. It was that bad for me. Well, you know, I have great coworkers like Maria Jose, and I have a great family like my sister Alejandra, who's also a park ranger. And they said, Fatima, we need to get you out walking, because that's what the doctors had prescribed for me. Get out there and walk as much as you can. But when you're in pain, when every single joint in your whole body, and I mean where you can't even open doors because your wrists hurt that bad, you really don't want to get out there and walk. But these girls, they're like, Fatima, we'll go at your pace. See, I was embarrassed to go out walking with them because, you see, Maria Jose was already out there walking with the community. She had created a program, Let's Move on Crissy Field. Let's Move in the Headlands. She was getting people excited about being outdoors, using the park as their outdoor gym. But I couldn't keep up with that. She's hardcore. She's high impact. But Alejandra and Maria Jose said to me, we'll go at your pace. You'll set the pace. And I was like, are you sure, girls? And they were like, yes, let's do it. And while we were on that hike, while we were, you know, struggling up the ecology trail, we started thinking, wouldn't it be awesome to have programs that catered to the person that's the slowest walker? So that people like myself that felt embarrassed to join a walking group, that felt, you know, depressed that I couldn't move anymore, that felt angry with my body for letting me down, could get outdoors again, could use the park as their outdoor gym without feeling embarrassed. Well, that's where it all started. Maria Jose, Alejandra, who's not here, and myself decided we were going to do it. We were going to create a program that catered to all ages, all abilities, whether it was a physical ability or disability or a medical one, as mine was. And Maria Jose is going to tell us more about what we created, 3 years ago now? 3 years ago now. I am 100 pounds lighter, I have to say, and oh yeah, can I boogie, let me tell you. Thank you, Maria Jose. Now let's show everyone how we are doing it so that all of you can join us and start doing healthy parks, healthy people in your parks, in your communities, and use your national park or any outdoor space as your outdoor gym, as I have.
So it did take a little convincing to Fatima. Come on, let's go on a walk, let's go on a walk. And she was like, no, I'm just going to stay and catch up on my emails and stuff like that. But as you see, it really paid off. So what we ended up talking about, we wanted to, as she said, include all ages and all abilities to be able to go out to their national park and even just meet other people who had similar issues. So we started out at first with inspiration of Michelle Obama's Let's Move campaign. So as she said, I was already leading little walks, but my little walks were from 2 to 5 miles, going up to the top of the Marin Headlands hills and everything. So what we talked about was something that would include the whole family, that kids would also be involved as well, because Michelle Obama's Let's Move was mostly catered to children with childhood obesity. So we started out in January of 2013. That was our official launch of our, what we used to call Let's Move Boot Camp. And that was a kickoff for Healthy Parks, Healthy People before we knew it was called Healthy Parks, Healthy People. So we started leading programs. We did boot camp. We would start every morning with some stretches, some activities, some exercises on the lawn, but we would also incorporate interpretation. So we would be marching across the lawn in the main post in the Presidio, but also talking about the history that was around us. So what we have existing today is the first Saturday of every single month, we host a Healthy Parks, Healthy People program from 2 to 4 p.m. We decided to do it in the afternoon because, as we remember from Fatima's experience, in the morning she just could not move. Her body was not warmed up yet. And also in the Presidio, it's not too accessible by public transportation in the morning, so we decided in the afternoon it might be a little easier. So we meet every month at the same place, same time. And this is Alejandra on the picture here, back in the day when we would start it off. So this is actually a picture of Fatima back when we first started this. So she still had her cane, she still had stuff on her wrists and everything because her joints were still in a lot of pain. So all fitness, all abilities, we decided that each one of us would represent a fitness level. So I was designated as high impact, even though I don't believe it myself. I tried to keep up with the participants sometimes. So Alejandra represents the mid-impact, so kind of active, but not all the time. And then Fatima, the low impact. So all ages are welcome. So we want our programs to reflect everybody. So we've had seniors on our programs. We've had babies in the strollers still on our programs. And the first one of those series that we created is Family Boot Camp. So we would jog up the ecology trail with the high impact, and while the low impact is walking up the trail, we would go back and forth to catch up with them so that everyone is doing some sort of activity together, but at their own level. So Family Boot Camp is one of them. Another one that we offer is Hiking for Heartbeats, so just that traditional hike, getting out to nature, exploring something new in a group. And Family Fun Fitness is my personal favorite. So I like to think of fitness as being fun all the time. You don't have to be necessarily going to a gym or just walking all the time. So to invite the families and the children especially, we created this program more involved with games. So we brought out the hula hoops, jump ropes, tag, balls, and everything to have kids really do full body exercises without telling them it's exercise. So we're like, we're gonna play a game. And they're like, all right, can we do the obstacle course again? We're like, okay. So this was actually last month's Healthy Parks, Healthy People program. So every program, we provide beginner warm-ups and exercises as well as cool-down stretches. So we start off with stretching out whatever body parts we're going to use mostly for the program. And then at the end of the program, we like to cool down. If we especially did Family Fun Fitness, we were just doing a game with the kids, we like to cool it down and bring our heart rates down again. So we're not like so. And we also provide a hike in every portion of the program. Even though it's not hiking for heartbeats, we still have them walk from one part of the park to another part to get at least 20 minutes of walking inside the program. And something that we like to add to our program, we thought it was very important. After doing exercise, we provide a healthy snack. So we thought, you know, most of the time there's these bars that have a lot of sugar in them that are offered at like morning walks and stuff like that, and we didn't really like them personally, and we didn't want our participants to be eating them either, so we decided to go a more natural route. So we infuse water with fruit to make it taste a little better. We give them apples, all organic, little snacks that'll help keep them with a high energy. And we also sometimes stay a little longer after the program to have lunch with them as well, because they're just enjoying their national park, and we get to make connections with them and invite them back, get to know our participants a little better that way with a little food. So with our team, we've been leading these Healthy Parks, Healthy People programs officially as Healthy Parks, Healthy People. In June of 2013, we had an official launch in partnership with the Institute at the Golden Gate. We launched HPHP Bay Area, and now Healthy Parks, Healthy People is all over the Bay Area. We sometimes even go to the programs that they lead in the East Bay Regional Parks and get to see what they're doing. So since we've been doing it on the first Saturday, originally we started the second Saturday of the month, we have been just kind of sticking to that same same time, same place, every single month. But we are actually the community programs team for the Presidio and Golden Gate National Recreation Area. So as a team, we decided to expand Healthy Parks, Healthy People, and bring it to the communities that we're trying to bring to the park. So we've been doing pre-site visits, going to different community groups, introducing ourselves first, and saying, hey, we are your friendly park ranger. We invite you to come out next Saturday to Healthy Parks, Healthy People. And that has actually helped our participation as well. We see the participants the next week, and they're like, I remember you from last week. Do you remember me? And we're like, totally. Let's go for a walk now. So we're able to really form those relationships with the families and with the people who may not have come on their own. They probably needed that extra push, that person saying, like, I will go with you. You will be walking next to me on this program. So it's been a lot of fun creating all this relationship. We also offer it in Spanish and Chinese. We both speak Spanish, so our official launch in June of 2013 was a trilingual program. We had the whole spectrum. We had seniors, we had the children in the strollers, and we had split them in 3 groups because we had such a large group. And in each group, we had the whole age range and the 3 languages, Spanish, English, and Chinese. So it was, I think, our best program yet. We're going to try to do it again. We'll see if we can do it June as well. So there's also different community groups who say, hey, you know, our group doesn't meet every Saturday, or we are just a group of friends and we want to come out, but we don't have any vehicles to get out there, and we can't take all the kids and the strollers all in the transportation buses at once. So we decided that we can schedule a custom program on another day of the week. When possible, we've been able to provide transportation to bring them out to the park to make it a little easier if they really couldn't afford it. So we try to make everything possible to bring them out to the park, or if not, we bring Healthy Parks, Healthy People to their neighborhoods, to their communities, so that it's not just about, oh, the national park, and that's where they're gonna be healthy. No, it's in their whole life in general via the national park, so we can promote them coming out on their own, coming out and bringing their friends and families as well. So that's how we got started. I bring my family whenever I can, pull them out of the house and bring them out to hike in their parks. But yeah, it's been a very exciting journey to be able to share something that we like to do in our park with many different communities who really, really have been benefiting from it. So yeah. This is our online flyer. If you'd like to join us on April 4th, we will be leading Family Boot Camp. If you would like to meet us in the Presidio to do a little exercises with our drill sergeant here, Fatima. So, thank you.
Thank you so much, and I definitely recommend, especially for you local people, to get out and join these wonderful women at one of their first Saturday programs. It's a lot of fun, and they will work you hard. Director Jarvis, would you like to come up and join us now? Do you want the podium or handheld? Okay. We'll kick it off by getting some remarks and thoughts from Director Jarvis, and then I've got some grilling questions for them, and we'll hear from you all as well.
Well, good morning, everybody. Lots of familiar faces in the room. It's good to be here. You know, a couple weeks ago, I was in Selma, Alabama, for the Selma to Montgomery March. We have a park there, the Selma to Montgomery National Historic Trail. And as we were integrating into the crowd of 60 to 70,000 people as we were marching through Selma, and I was looking up ahead of me, and there was the Edmund Pettus Bridge, and it was completely packed with people. And I turned to one of our incident command team, and I said, did anybody do any calculation on the weight load of the Edmund Pettus Bridge? And he said, yeah, we calculated it at 150 pounds per person. And I said, have you seen the people of Alabama? You know what, I think some of you are probably wondering why we are starting the George Wright Conference with this discussion about health. And I think it was mentioned by all of these folks, it's a positive. It's a good news story that the work that we do in the national parks and the state parks and the regional parks, city parks across the nation, we have something to offer. We have kind of a secret that this antidote to obesity and cancer and depression and heart disease is essentially free. And in some cases at your doorstep, and in other cases it's not. And we, at least in the National Park Service, but I think within our broader parks community, have the ability through a variety of programs to deliver this resource, this component of the healthcare system to the American public for their benefit, all of the benefits that I think Ray and the team here have all indicated. But why should we care, I guess would be the second question. You know, all of you out there are dealing with issues of water quality or air quality or endangered species or park conservation or global climate change or all things. You know, how is this relevant to the greater work? And if I can take a second to sort of put it in context, at least for me, how I see this. So in order for us to be successful in conservation and historic preservation into the future, to help the planet persist, if not thrive into the next couple of centuries, we need public support. We need to be relevant to all Americans. And this has the potential to be a game changer. If the American people see parks and their maintenance, as in their care and their quality, as an integral component of their lives, they're going to support them. They're going to support their funding. They're going to support them politically. You won't get cranky phone calls about dogs, all those kinds of things. And let me say that this has worked in the past. So just a quick historical reference. In the Park Service's history, Mission 66 was a public awareness campaign. We think of it somewhat as an infrastructure campaign, but it was actually an awareness campaign. And from 56 to 66, we ran a public awareness and a construction program to connect to the American people. And they came. And they came in droves. Millions and millions of people came and experienced the national parks. And then guess what happened? From about the mid-60s to the mid-70s, and I think there is a pretty good correlation here, that the Congress passed the bedrock of conservation law. So the Wilderness Act, 1964, the National Environmental Policy Act, the National Historic Preservation Act, the Land and Water Conservation Act, the Wild and Scenic Rivers Act, and the Endangered Species Act all passed in the mid-60s to the early 70s. Earth Day, in all of those. And then the additions to the National Park System that came out of that same period: Golden Gate, Gateway, North Cascades, Canyonlands, Guadalupe, Assateague, Redwood, Frederick Douglass, Point Reyes, all were added to the system by Congress, not by an act of the president. And so what we learn from that, or can take from that, is by creating a deep, resonant connection with the American people, it translates into support. And those are the bedrock laws that we are at least able to do conservation and historic preservation today. So I think that asserting aggressively and creating this connection with the American people, with the medical, insurance, and public health sector of the nation, which we spend, 18% of the gross national product or something like that on today, can build an extraordinary amount of relevance into the bedrock of support that we need in order to accomplish our broader goals as well. One or two more comments about this is that there is some skepticism, and we've got to build a body of research body of longitudinal studies, good quantitative work, and we have a research agenda that has been developed around this. But a few years ago, we held a public meeting, and the chief medical officer for the Health and Human Services got up in front of a very large audience, and she said, "I've looked at the research, and I'm not so sure the outdoors are good for you." And essentially started out the discussion with the case that she thought the hazards of being in the outdoors, you know, sunburn, bugs, all those kinds of things, versus exercise indoors, she wasn't sure that the outdoors are that good for you. And so we've got to really build this because that drives the research, the medical and insurance community out there is good quantitative and longitudinal studies, and there is somewhat of a dearth of that. The good news is this is international at this. Our great appreciation to Australia really starting this. I'd say the US is now leading this effort, but there are over 35 nations now have adopted Healthy Parks, Healthy People. We've got over 100 pilot projects running around in the US right now, and a huge opportunity. So I'll stop right there and then turn it back to you and take questions.
Give me that woman's home phone number. I'll convince her, I promise. Well, and I think that was a great introduction there. In the last couple of years, the amount of action that has happened across the country on this topic has tripled. I've tried to figure out the algorithm and the math to figure out where we'll be in 2020, but I haven't figured it out quite yet. But I'd like to ask a question to our panelists now. So a lot of these projects that Director Jarvis was alluding to started from individual champions, whether it be a wonderful park ranger here at Golden Gate who was personally passionate about getting healthy themselves, whether it be a pediatrician like Dr. Robert Czar in Washington, D.C., who saw every single day that he didn't have as much to offer to his patients, but giving them a prescription to take a walk outside was something he could offer to them. So these individual champions have really kind of started a lot of these programs, and I'm wondering now, if we're here to make a major impact together, what are the policy shifts? What do we need to adopt for long-term systemic change? And I will start with Dr. Baxter, I think. So what do we need to do as society to make sure that it's not just one-off individual champions running these programs in the future?
Well, I think one of the real challenges in the health system sphere is that the fundamental incentives remain for people to do activities and get paid for doing activities. So when I described the Kaiser model earlier of being prepaid, that changes the game and it changes all the incentives. So our doctors are all on salary. They have no incentive to do something and then get paid for it. They have an incentive to keep you healthy. But this isn't about Kaiser. This is about the way in which the rest of the health system tends to work in this country. Just is that if people, doctors and hospitals and clinics don't have a way of getting paid for doing something, they don't do it. Well, think about the examples that I was getting. Nobody pays a doctor in private practice in most places for prescribing walking. No one pays someone for telling someone where a park is that they can get to. No one pays a hospital, reimburses them for contributing to the development of parks and trails in their communities or building green spaces as part of their development. So the shifts that are underway now in health policy should be seen by this group as critical to the future of parks. Now, I know that seems like a stretch, but the shift that is happening in American healthcare now is a movement to pay for value and for health rather than paying for a volume of activities. And the more that takes hold, and it is beginning to take hold, the more hospitals, doctors, health insurance plans will have an incentive to do things that lead to people's health rather than do things that get a reimbursement tied to them. So that change in health policy, I would argue, is fundamental to changing the way in which a whole sector, the sector that is chewing up 18 to 19% of our gross national product, that sector to want to support parks and nature and being outdoors as a part of health rather than seeing it as somebody else's agenda.
Thank you, Dr. Baxter. Anybody else would like to add to that?
right, so the way I understood the question is, what can we do to change the attitudes in society?
Yeah, you guys in particular have one of the most successful Healthy Parks, Healthy People programs now in the Bay Area and across the country. Who did you have to convince? How did you do it? How do you make sure that these programs are offered as long as possible to the participants?
All right. Well, what I have to say to that is getting the participants' voice heard. In my example, just when we first started with the three of us, Maria Jose and Alejandra heard my voice, right, my need. And so what we have been doing in our program is going out to the community centers, going out to the people and asking them what they want to see when they come out on the program. And that's how we retweak the program. And then we pass that information on to our upper management, to our chief, to our supervisors. And, you know, they also see the benefit of getting people outdoors or of using our parks as their outdoor gym. But it starts out with the people hearing their voice. What is it that they need? What is it that we need to provide for them? So it's not about us creating it out of, you know, what benefits us. It's what does the audience need and how can we make it happen? And that's how we're making it work for us. And so then upper management supports it. That's how it's worked.
Director Jarvis, do you want to add anything to that?
Well, I think that changing the way we think about healthcare is key to it, and I think Ray sort of touched on it. But you know, we have a healthcare system that's designed to keep you sick, basically, because that's how they make money. To be blunt about it, and the Affordable Care Act gets a lot of heat and a lot of politics around it, but at its essence, it's a preventative law. It's a law designed to try to keep the public healthy. And what I think we're finding is that the medical community is looking for new things. And that's why I think this is beginning to build traction at the individual level. I spent the day down at the Center for Disease Control last year talking to their team, and they're very interested at the understanding health at the community level. And I think the heat maps that Ray put up sort of begin to indicate that there are communities out there that are park deficient, just like they're food deserts, they're park deserts. And I think if we can begin to make the case with an organization like CDC or Kaiser to say we can go in, use all of our assets, and in the Park Service like RTCA or the state side of Land and Water Conservation Fund or others to create parks in communities that are showing high rates of obesity, and partner with an organization like the CDC to really do community health assessments and then demonstrate over some time period that you actually move the needle. Then you begin to build the kind of political support that people then demand this of their politicians and funders, that I want that too. And then you begin to build the infrastructure of parks within that. And then, you know, we can bring things like, well, that park isn't just a recreation site, it is also a stopover for the monarch butterfly. It's a part of the green infrastructure of that system. It's providing filtration to the local stream systems and all of that, and you really begin to build an environmental infrastructure as well as a health infrastructure.
Thank you. This question is specifically for Dr. Baxter. Have you had any kind of backlash within your healthcare providers when you've asked them to prescribe walking to patients yet? Or how did it really come about? How did that get put into the electronic medical recording system? Kaiser Permanente is, of course, one of the most innovative healthcare systems we have in the country. So I'm just curious what the biggest hurdle was for getting your providers.
It actually came from our providers. This wasn't somebody else that had a brilliant idea one day and said, you all ought to do this. It really came from within and from our doctors who were saying, you know, we're performing at the 95th, 97th, 98th percentile. We're doing everything people say you should do to get high quality scores, high prevention scores, and so forth. And many of our members are coming back after a visit, and they're coming back and their blood pressure is 10 points higher and their weight is up by 5 pounds and their diabetes is exacerbated. We have to be able to do something more about the circumstances in which people are living, and recognizing that it's not just that people choose not to live healthy lives, it's how it's systematically underlined by the way our communities are designed, by the way we've engineered activity out of work, essentially. I mean, I had to laugh when you got everybody to stand up, but this notion of a culture that works by sitting, or a culture that, if you look at the way, go into a fast food restaurant and look how work is engineered. People basically don't move. They can serve you by turning to the right, turning to the left, pulling something from here, bringing something over to here, and handing it to you. So even in the workplace, we've systematically removed activity from it. So there's a recognition that we have to engage in more of that. It's not a backlash, but the resistance is, once you ask someone, are you active? And that person says, not really, but I would like to be. Now you have to do something. Now you're not asking a question that gets something recorded in a medical record. You've now been asked to engage in helping me. And somebody says, well, I want to be more active, but where I live, we don't have sidewalks. And many people are astounded how many people live without sidewalks in urban areas, but it's true, it's extremely dangerous. Or I don't want my children out after school. I would rather have them where I know they're safe, sitting on the couch, playing video games, watching TV, rather than out in the community that we live in. So now you've put the physician in the place of saying, well, how do I solve a set of social problems out there? And while the physician or the nurse or the pharmacist may want to help in that and may do it in their own time, the nature of the work environment doesn't permit that. So ahead of us is finding the ability to build the kind of partnerships that have been mentioned this morning and others that get the information available to people so that the physician or the nurse or the medical assistant in the office can not only say you need to be walking more and you should walking, but when you say you want to, say, go connect with Fatima, or go, here are the parks that are near you, or hit a button and a printout with a map that shows where the areas are that are near to you and safe to you. And we have a long way to go in creating that. But many communities now have a capacity to do something like that in terms of informing people about safe outdoor places to be. You have to make the connection between that and the office visit, though, if you want people to really embrace this a whole lot from the medical side, I think.
Great. Thanks, Dr. Baxter. So I'm not sure if anybody knows the statistic, but according to the Trust for Public Land, 98% of San Francisco residents live within a half-a-mile walking distance to a park and green space. We're the highest in the country, which is pretty phenomenal. But if you were going to do a similar heat map as Dr. Baxter showed, you could probably guess, if you're a San Francisco resident, which neighborhoods have the least access or the unsafest access. It's the neighborhoods that are typically underserved, forgotten about, ignored. It's also an area that we've had the most success in our park prescription programs here in the Bay Area, those communities who need safe access to the parks more than anybody else right now. So this is a question first to Director Jarvis, and I'd love to hear from Fatima and Maria Jose, but we're hearing the word relevancy, equity, diversity used quite a lot as we move into the second century of the National Park Service. What role do you see national parks playing, especially in urban areas? There's not a lot of other places that have a Golden Gate National Recreation Area in their backyard. And even here in San Francisco, it takes 45 minutes on a bus for a resident in Bayview Hunters Point to come out to a national park. So what role is the National Park Service committing to play in the next century to making sure that people are connecting to their park, that eventually do get a national park experience?
So I think we play an extraordinary role. First of all, and there is a session at 10 o'clock, I'll make a pitch for that, on our role in urban spaces, and we have an initiative called Urban Matters right now, the role the Park Service plays in urban environments. But I'll give you a perfect example. A couple of weeks ago, Gary Mackless and I went to Detroit and spent the day in Detroit. I spent literally about 3 hours driving around Detroit with the mayor of Detroit. Detroit is going through probably the a classic collapse and rebuild of your typical industrial city, maybe worse than most. But they're literally, the city created a land bank, part of their organization, and they own 40,000 lots now that are owned by the city, and they're basically tear downs. There are places that are 15 blocks by 15 blocks that are completely unoccupied, just open space. So the opportunity to rethink that city in terms of a green space and parks to communities is extraordinary. I mean, it's you know, if we had Frederick Law Olmsted today, he would be in Detroit, you know, working with them now. And we don't, and guess who we do have? We have the National Park Service. We are there with the city to figure out how they can transform a city that has a lot of challenges, many more than were listed. But the creation of a robust green space and park system that is integrated into the communities can help that city recover economically, environmentally, and from a health standpoint, and from an education standpoint as well. There's one particular area that an individual has torn down 500 homes and is planting a forest. And there's a school next door that could be totally connected to that from an education standpoint. So the Park Service is part of the relevancy, I think, issue that I'm dealing with the Centennial. And by the way, if you haven't been watching the news, we launched Find Your Park this morning with press release, AP reports, video from the First Lady, the honorary co-chairs, Michelle Obama and Laura Bush, and we go full live on Thursday in New York City, where I'll be. But it's all about this concept of Find Your Park, which is an invitation for the American people to find themselves within one of these places, historic or natural. And I think that is part of our role. The Park Service has such cachet, such high public profile, that we can help the public recognize that parks are integral to their lives for all of its multiple benefits, even if it isn't a national park itself. It's a piece of public land, it's a state park, it's East Bay Regional Park Authority, all of that. That doesn't really matter. What it matters is getting people to incorporate this into their lives, and then there is a sustained use of that over time.
Great, thank you. Maria Jose and Fatima, you are a unique position where you're direct service providers. You get to actually work with communities on the ground every day, watch them as they get healthier and more excited and happier spending time outside. What do you guys see as the role for national parks here in the Bay Area in getting people healthier?
Well, for me personally, and also probably for Fatima, we love to be a role model for the community and for youth as well. So we love it when we have youth, children on our programs, because the level of energy is that much higher. And a lot of the times, the youth that come out to the programs, they don't normally go outside, or a lot of times they come out and we take them to see Chrissy Field or right by the beach, and they're like, I've never seen the beach before, and they've grown up in San Francisco. So it's creating that kind of first experience for them and being that friend to offer those opportunities to have that connection for the first time, or for many, 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 many first times. So one of the things that we also do in our team, in Golden Gate, we have a truck. It looks like a food truck, but it's called the Roving Ranger. And I drive that truck with one of our park ranger friends, and we go out to different fairs, festivals, and community events, and we bring out little Wheel of Fortune prize wheel, and we bring healthy parks, healthy people to the community. So right there on the spot, we create a little exercise that maybe they didn't think to do exercise at that moment. They thought they were going to get a lollipop or who knows what kind of prize, and it lands on mystery, and we're like, okay, we're going to do 5 squats together. They're like, what? They're like, are you with me or not? They're like, okay. We're like, 1, 2, 3. And then they're like, what do I win? I'm like, you just got your exercise for the day. And they're like, oh, but you also get a Healthy Parks, Healthy People sticker. So we create those little connections and stuff, and talk to the parents as well and tell them, like, you know, are you looking for things to do with your family? They're like, why, yes. Well, we have something for you on the first Saturday. So being able to bring that out and being able to show these youth as well, like nowadays most of the youth, they don't really know what to do. I know when I was going into college, they asked me, like, what are you gonna be? What do you want to do? I'm like, I don't know. But I was very blessed to be able to start my career in the National Park Service straight out of high school because I was part of a internship program in our national park. So we were able to connect to these youth by offering them an internship opportunity or just inviting them to come out and volunteer in their national park. And through that, they're able to see a career path in their life that they hadn't thought about before. So that's one of the things we also do as well.
I'll try. All right, so for me, I'm an immigrant. I came to the U.S. when I was 6 years old, and I grew up in the Mission District in San Francisco. And you know, as an immigrant child of a single parent, a single mom, I really didn't get outdoors very much growing up, except the local playground that was close by. I didn't know that there was a national park here or anywhere in the Bay Area. I would see Yogi Bear on TV. So I heard about, you know, this mythical national park, but I didn't know that they were for real. Even when I went on a field trip, I really didn't know that I was visiting a national park site when I went to Ocean Beach growing up, or when I took my little sister to Ocean Beach, because my mother was always working. And so with these stories in the back of my head, I think about the youth and the families that are immigrant families, like I was growing up here in San Francisco or in the Bay Area. And I want to make sure that they don't go through what I went through, of not knowing that we have these treasures right here in our own city. And so for me, when I create a program or when I revamp a program that I already have existing, I try to make it relevant to their experience. And so a lot of the programs that I lead will have a little bit of storytelling in there from different parts of the world. So if people that are coming to my program are from Latin America, they'll have a little bit of home in that program. And they'll also get a little sense of ownership of their national park site, because it wasn't until I started working in the Presidio that I realized that the national parks belong to all of us. I had no idea of that concept, you know, and how can you feel ownership of a place if you don't know that it belongs to you? So that's something that I have always tried to change by my programs, the way I deliver them. And also because as an immigrant, I always felt like I didn't belong, right? You don't belong in the US, and you don't belong in the country that you came from, because when you go back to visit that country, they see you as a gringa, which means a foreigner. And that's been my experience. So when I have people of diverse audiences, diverse groups in my programs, I want to make sure that they know that their story is in our park. You know, that they belong here in the US, even if they were born somewhere else. And so the stories that I incorporate, whether they're the stories of the park, I want to make sure that all those stories I tell are relevant to their experience or to their history, or to their future. So that's kind of how I'm addressing relevance in programming delivery and in Healthy Parks, Healthy People. I started off today with a little movement, you know, telling the story of the Presidio being a military base by actually getting you to move. Now you know it was a military base, and you actually felt a little bit of the experience that the soldiers may have felt, right? Having to wake up very early in the morning and having to march everywhere. So little things like that. But the other thing that I'm incorporating into programs is this concept of asking the question of the audience. You know, where they come from, what they want to have in their park, what they want to see, what stories they want to hear, through a facilitated dialogue. It's It's an old concept, but it's a new concept at the same time. You know, it's something that we, the park rangers, are relearning. We do a lot of the tools of facilitated dialogue already, but now the National Park Service is taking us a step further in really learning facilitated dialogue to incorporate the voices of our public. And that's really, I think, a way to become very relevant, because if we know the stories of who we serve, then the programs will be that much richer, that much stronger, that much relevant, and that much better.
Thank you so much. So one final question for all of you, and I'd ask that you keep it to about 1 to 2 minutes. So there's probably a lot of people in this room who would love to do what Maria Jose and Fatima are doing right now. We've learned a lot from all of you. What is one piece of advice you would give to people in this room who want to make more intentional park health connections in their own communities and in their own roles beginning on Monday? What would you tell them? Director Jarvis, would you like to start us off? I didn't throw you a dog question, so I feel like it's okay. I can ask you to go first.
Well, you know, when you're watching the evening news, there are all these commercials, particularly targeted to my age group, and they say, you know, talk to your doctor, you know. Well, when I go to my doctor, I prescribe the outdoors to him. And so, you know, he tells me what I need to do, and I tell him what he needs to do. And I think each and every one of you have that opportunity to engage with your own medical practitioners, and then, you know, what I think is really fantastic about this little discussion is that you're looking at it, we're demonstrating to you at all levels. You know, you sort of got me talking at the high, sort of international, national level. You have Kaiser here representing the sector that we have always wanted to be here with us, and we want to be in their tent, and it's fantastic. And then you've got these two fantastic rangers who are delivering at the community level. And we have the Institute, who is helping us sort of formulate policy and develop the policy and practice and get the word out. So I think take a look at this and see if you can replicate this kind of multi-levels wherever that you are practicing.
Thank you. Maria Jose?
I think most importantly, I have to do this over and over again, sort of rediscover your park or your place, wherever you come from. Try to rediscover it for the first time again and see what else you're learning, what else you'd like to see, and see how you can provide that, whatever is missing, what you would like to see. Like, oh, I think it'd be fun to do this. Well, why don't you do that? And tell all your friends and family as well. That's really the stronger relationships that we build, are the people that we know. You don't know whether they need to do the same thing. Like Fatima, I didn't really know at first that she didn't want to go walking with us. I was like, oh, maybe she's really busy. But then later on, we got to know a little better. Like, no, she really did want to get out there. She just needed that extra support. I needed to go walk with her, you know? But just really getting to know your people around you, rediscovering it again, and sharing that excitement and getting excited over and over again to be able to continue and grow from that.
Great, thanks.
I say partner up, find partners. We're lucky, we have the Parks Conservancy on our side, and that's how we are able to provide transportation to the community groups that we've also partnered with to bring the people from Hunters Point that live across the city, literally, that it would take them a long time to get to the park on Muni, on the public transportation. So find partners, whether they're community groups so that you have an audience, so you don't have to be the one trying to get the audience, you know? Get those partners, those leaders from the community groups, from the nonprofit organizations to help you with the funding that you need to get transportation to bring that audience to the park that can't get there on their own. And then, you know, go out there, go to the community groups, go to the after-school programs, go to to the churches, go to all those places where people are already meeting, where they are already wishing to have some kind of outdoor experience, and make it happen for them, right? Work with them in community, ask them what they are looking for, and then create it together. Because if you create the program together, they are gonna love it, because they help plan it, they help make it happen. And money should never be an issue, because you know, when you get the right partners, they will provide. God knows we know, because we don't have any money.
Dr. Baxter?
I would probably say help the adults in your life rediscover the joy of being outdoors. Children get it instantly when they're in it. The adults are thinking about, you got to get the car, I got to get the car packed, does anybody have the food? It's all the logistics. It's what are we going to do when we get there. It's not about simply rediscover the joy of being outdoors. And that means us talking to the adults around us about that joy and reintroducing them to that.
Thank you. I want to thank all of our dynamic and wonderful speakers for joining us this morning, and thank you for the work that you do every single day. So a shameless plug, if you want to know more about, if you want to do a deeper dive into the partnerships that are existing here in the Bay Area and across the country, to learn about how San Francisco became the first city in the world to adopt park prescriptions, join us at 1:30 for a deeper dive session. But as we heard earlier, if you could swiftly get up from your seats, get your park prescription on, and head outside. Thank you so much.